Hi, this is Linda Beaver, your health consumer advocate from Health Education Media with another Did You Know segment. Did you know there are 5 simple questions that you should ask your doctor about your treatment? Simple questions such as ask for a treatment outline can really help you understand what's going to be involved from the time you start a treatment program. You'll know what the expected commitment to treatment visits would be. You'll know if you've got to take medication. You'll have a time frame that might vary as the treatment progresses, but it will still give you some idea about a realistic expectation of outcomes and within a given time. So ask for that treatment outline, but always understand that the treatment program might vary over time. Question number 2 is to ask why a medication is being prescribed. If a tablet or medication is being considered as an essential part of a treatment, ask what it's going to achieve, why you've got to take it, and all the other questions that have been identified previously in another Did You Know segment about medications. That is there something else that you can do to prevent you from having to take a medication? What is the cost going to be? Is it a forever medication? Are there any complications that you need to know about? And is there anything special that you need to know about that particular tablet, such as take it with food, take it at night, take it in the morning, or similar things? Always remember to ask about medication. Also ask why a particular test or investigation might be needed. So often as part of a treatment program, you have to go and have blood tests, or you might need to get an X-ray or a scan. Best is to ask why, because if it's not absolutely essential, it can save a lot of money and time, particularly if you live in a rural community where access to a lot of these services is very limited, and often you've got to drive a long way to get to the place that's going to conduct these particular tests. Always ask the question because it might not be essential. Ask about the expected costs of your treatments and the investigations. This is really important because sometimes the costs can be quite exorbitant and not all are covered by Medicare. And so if you've got private health insurance, you still have a gap payment you have to consider. Ask about the costs. Ask again if the treatment is absolutely necessary or the investigation or test is necessary, and make an informed decision about what's going to work for you. And finally, ask for information about your health issue and make sure that that information is going to be presented to you in a way that is suitable for you to access and to understand. Some of us like to get written information in flyers and brochures or be referred to websites. Some of us like to listen about information, particularly if you're doing a lot of driving or like to listen to podcasts or data when you're using public transport. And also there's the option of YouTube clips. These are often developed so that people can talk about their experience, and it gives you a real insight into a particular health issue. Your doctor should be able to give you some information that will help direct you to the best source of guidance, people's experiences, and general resources that will help you understand your particular health issue. This is Linda Beaver, your health consumer advocate from Health Education Media, empowering health consumers.